My name is Lauren, and I was diagnosed with schizoaffective disorder in 2016 when I was 25 years old. I've been living with this illness for roughly 8 years now and kind of struggled with my mental health even before the time I was diagnosed. For the majority of my time kind of trying to learn how to manage my illness, it was very much a focus on medication. So antipsychotic medication, mood stabilizers, sometimes anti-anxiety medication, antidepressants, just kind of trying to figure out what the right balance was for me to mitigate side effects as much as possible, but to still keep my symptoms under control. I also did a lot of talk therapy throughout these years, which was helpful as well. But it did seem like I was never really getting at the root issues or the root causes of why I was experiencing schizoaffective disorder and the symptoms that came along with that. In 2020 around, I started to read some articles or information that was coming out about the potential beneficial effects of the ketogenic diet in treating mental illnesses such as schizoaffective disorder or schizophrenia. And so I got kind of curious and I decided to give it a go along with my partner. But we really did not know a lot about it. There was not a lot of information out there about how to do it in a proper medical way. And so it didn't really have much of an effect. And the pandemic came around. And so we just kind of put it to the side on the back burner for a bit. But then we had Dr. Christopher Palmer come on our YouTube channel. I run a YouTube channel called Living Well with Schizophrenia, where we've documented my experience living with and managing schizophrenia. And we had him come onto our channel to talk about mental illness as metabolic dysfunction. And he shared more about how the medical ketogenic diet can be a really useful intervention for improving your metabolic health and subsequently your mental health. And so we got more curious about this and eventually decided to really just completely dive into using the medical ketogenic diet as well as other metabolic therapies in an effort to treat and manage my schizoaffective disorder near the end of 2023. So that was when we kind of got started. And over the last 7 months, I have just been deeply immersed in using the ketogenic diet and metabolic therapies like exercise, regulation of sleep, social engagement, and just kind of focusing on all these pillars of wellness, essentially. And it has had a profound impact on my experience of my illness. I no longer experience symptoms that used to really incapacitate me for much of my life. And I just feel so much increased capacity and I feel like I am thriving. I shared that the main focus of my treatment for so many years was psychiatric medication, but I am almost completely off of psychiatric medication now, which was just never possible up until this point. There's something that's happening right now, like over the last month, maybe up until this withdrawal that I'm going through now, where it felt like things were just kind of starting to click. Like, I think for the first few months, I was kind of struggling with experiencing an increased capacity, but not really knowing what to do with that because it just wasn't my norm or my reality for the bulk of my adult life. Over the last month or so, things were starting to click, and I was able to really step into this newfound capacity in a meaningful way and just felt more present and capable within my life. If someone came to me asking me, why I would recommend using ketogenic therapy to treat a mental illness, I think I would really just want to try to convey how empowering it has been using this means of treatment that is really all about me making choices that are in line with taking care of myself and bettering my mental health and my overall well-being. That in itself has been so empowering, but even beyond that, the effects it's had on my experience of my symptoms has been so much more profound and better than the psychiatric medications or, traditional treatment modalities that I have gone through. Those treatment modalities, such as medication and whatnot, also come with a slew of side effects that have been really difficult to navigate. And there just aren't really any side effects of using ketogenic therapy. I guess you could say there's a side effect of it being a little bit hard to stick to because it maybe does feel a little bit rigid at times, but that just kind of pales, as a challenge in comparison to the huge benefits that I've received from it and how it has changed and improved my life. I've grappled with the question of if I would go back and, decide never to have experienced schizoaffective disorder, would I? That's kind of a question that a lot of people bring up. And my answer has always been, of course I would choose that. It's been a huge struggle, and I would absolutely choose to just not have schizoaffective disorder. But I don't know, now that I'm moving into a space where it doesn't really impact my life in the same ways or to the same degree, and I have learned how to alleviate my own suffering, and I'm in this kind of position whereby I have the opportunity to help others alleviate their own suffering, I think that that's a really worthwhile place to be in. And I also understand that I have learned and grown immensely through my experience of navigating my mental illness. It has taught me huge lessons in compassion and empathy, and I guess just what it means to experience suffering as a human. And I think that I'm in a position where it's not a reality to go back and eliminate that experience and choose to not have had schizoaffective disorder. So I'm hoping that I can move forward in a position of being grateful, or of, I guess, embracing my experience in an effort to help others navigate their own suffering.